each type of dermatitis has a different root cause. And that's why labeling it as dermatitis just isn't enough. For example, applying a steroid cream may help with atopic dermatitis, eczema, but it could worsen infectious dermatitis. Likewise, moisturizing helps with eczema, but won't solve stasis dermatitis unless the underlying circulation problem is addressed. It may make it a little better though. So how do we identify the type? Diagnosing the exact type of dermatitis involves looking at several factors: when it started, where on the body it appears, what triggers it, and any other health conditions that you have. That's very important. Sometimes tests like patch testing for allergies, skin biopsies, or blood work may be needed. So, as a doctor, in some cases of dermatitis, you have to be a detective and get a very good and extensive history to come up with your top reasons for the patient's dermatitis. I often spend a long time on having the patient remember what happened at the onset of dermatitis or what preceded it. Were they traveling, or did they change their hygiene products or bed sheets? And the list goes on. In conclusion, if you have been told you have dermatitis, the next step is figuring out what type it is and what's causing it. Your doctor should be your fellow detective in this process. And that's the only way to get the right treatment and the lasting relief. And remember, your skin is telling you something. Finding the root cause is the key to solving the problem, not just covering it up.